I'm Iñaki Gamborena. I'm a dentist from Spain. I was trained in several places. Actually, I have 8 years of postgraduate training. I did medical school in Bordeaux, France. I'm close to the French border. Then I went to Dominican Republic. I became a dentist in Dominican Republic. Because at that time we had a trade between Spain and even though I'm Spanish, I studied in France of my life. But at that time you had to be an MD to become a dentist, and I didn't want to do that. So I could validate my studies in Dominican Republic. So I went to Dominican Republic, became a dentist there. And when I finished, I realized that I needed more. So I didn't know any English at all. So I went into Mexico, and I did occlusion in Mexico City, and then I went to Monterrey and did training in prosthodontics 2 years, and I became a dental technician at the same time because I found out that maybe the weak link as a prosthodontist was the lab issue. So I wanted to know how to do my porcelain, how to create my castings, etc. At that time, we were not using CAD/CAM technology as we do more and more today. But for me, I could see that in the profession as a dentist, I didn't know how to do crowns. And I thought, well, I need to know how you need to do it in order to excel clinically. So I became a dental technician, and then I met John Coyce in 1990, and then I said, well, I don't know anything about perio, and he was just focusing on soft tissue and how important was the relationship between the interface of what we do, the preparation, the impressions, another total dimension that I was not used to see, and I didn't have into my background. So after my Mexican experience, I decided to learn English, and then I learned in 1992 in the Olympic Games, and now I remember I was already seated in Seattle at the University of Washington, US, at ESL English programs, learning English to go through all the TOEFL exams and all of that. So, and then I was accepted in Seattle, and I did grad pros. I spent there 4 years, and at the same time I was trained as a periodontist, even though I don't have the title as a periodontist, but I was involved heavily in the surgical part as well as the prosthetic part. So I'm really lucky to be part of this family of UW grad that have been through that program. I was lucky enough to have, I would say, as my dentist parent, Ralph Udelis, which passed away last year. So it's in my heart all my life because it really allowed me to be part of that elite group like John Coyce, Frank Spear, which are my mentors, and which I learned and created a big step in my professional career. After my UW experience, I couldn't place my own implants, so I was hired by the University of Texas in Houston, and I spent a full year fellowship in implant dentistry. And once I finished that part of my training, then I went back to Spain. I established in San Sebastian, and then a couple years after, and now it has been 16 years since I came from the States. And from the last 11 years, we are doing courses in GAT, Gamborena Advanced Teaching, where we teach mainly now more and more hands-on courses, workshops, hands-on courses, where we do, like Sasha does in Guide, a live treatment with not only on the surgical aspect, but the lab aspect, and combining lab aspect into the prosthetics, trying to give the full perspective of the treatments as far as if it's implants, surgery, prosthetics, from the lab to excel clinically in the mouth of the patient. So basically, I've been doing that for the last 11 years, and we are more focusing now more and more because of the foreign dentist demand into more foreigners than Spanish dentists. Well, I don't think there is not too much differences about how we practice in Spain in the rest of the world. Maybe as the guide followers, they should know that maybe we are the first or second country where we place the most implant in the world. Maybe you should know that. So we had also a lot of failures to fix, and yeah, maybe we have a lot of implants, difficult cases to treat. Basically, I'm more and more specializing on restoring whatever has been badly done. So it's not an easy job, easy day sometimes, because you have to fight sometimes more with the personality of the patients than what we have to do. But I think there is no difference from the past. We have the same problems like everybody does. We have good and bad dentistry like everywhere else. You should know that in Spain, the franchises, maybe we were one of the first countries in the world where the franchises started. So we have a lot of publicity on the TV. They spend a lot of money on that. So we can see that the patients are really informed. And today with internet, you know, it's maybe they saw it on TV, and this may be the little thing that they needed in order to go into internet and find more information. And I think this is maybe global, is a globalization really bring us to that need about our patient to gather information that sometimes is for good or for bad, but at least they know more about what they want. And definitely internet has exploded and has really provided that to our patients a lot. But I think sincerely is that the patient doesn't have a clue sometimes about what we can provide. And if they know it, basically you are facing a patient that is a problematic patient, you know. He's maybe knows too much, you know what I mean? So I worry about people that come to me and already know exactly what I can provide. That means they have been shopping around. Can be a conflict type of a patient because he knows too much. And this could be sometimes a red flag as far as, hey, listen, we can have problems with this one, you know, because he's demanding something that is impossible to provide. I think it's digital cone beam, having the possibility to have a cone beam in your practice, because now it's in our reach to have that. And this for me has been a total, I sleep way better, because if I want to control what I have done, I can in few seconds have an X-ray showing me what is the nerve and interpreting things that I was sometimes in the past only guessing, you know. So I have a right confirmation about where I am for good or for bad, but it really has exploded my vision about my vision about implantology, bone grafting, what we can do, the result, long term, how it works. We have a better understanding. And then the other aspect that has really improved my practice is the imaging, the software that finally we can provide a surgery in a prosthetic minded with novel clinician, having the final outcome of where the teeth are and where the bone is and which are the decision making approaches to our cases. This is something that really has really shifted the way that we do dentistry, implant dentistry in a more predictable way. Another aspect that has really improved is the CAD/CAM technology. Today we have beautiful provisional CAD/CAM. The tissue is totally different because it's not porous. We don't have to be dealing with the contractions. The zirconia frames, We don't have to, today the technicians really concentrate more into the artistic part of the prosthesis, rather than before. By the time that they were getting into the porcelain, they were already fed up of the case because they had to wax it up, cast it, the metal. So today we see also an improvement as far as the timing of the prosthetic lab really has improved a lot. I think it is a great question. I think we have to tell, and why I did accept this lecture is maybe to have a wider perspective, to get to as many dentists as possible into the guide family, to show them that it's not enough about doing bone graft or doing nice implant placement. Today you need to learn how to do soft tissue graftings, because this is what makes the difference. The soft tissue is really what creates a long-term stability of your cases. If we don't have soft tissue, prosthetically, we are missing the link. If we don't have soft tissue, it's difficult to hide the connection of the prosthesis into the abutments. It creates a difficulty as far as blending the implant into the oral cavity and within the rest of the teeth. So soft tissue is what creates the difference of doing it or not. Yeah, well, so far we are dreaming of that. I haven't used anything yet that can be a substitute in a predictable way. I'm looking forward to maybe harvest. The dentist could harvest soft tissue from a little blood sample, as we do for burn people, you know, to create soft tissue and maybe grafting that. This is already knocking into our doors, but it's not there yet. But I think it will really improve and catapult in a different position what we do in our daily basis. Well, for me, it's an interesting question. Having a broad perspective, because I try to train myself as the broader view of dentistry. You know, sometimes I'm a reference for young dentists. I want to be like you, and basically, I'm a prosthetic mind trained. But I want to learn about how surgery can improve my prosthetic work. And I think to really be able to control what we do in dentistry, you need to know about everything. You cannot get specialized only in one area because it will be more difficult to excel as an overall treatment planning. Like Sasha, for example, is an excellent surgeon, but sometimes he lacks of prosthodontics that can even improve what he has been able to create it surgically. So for a dentist, a young dentist today, I think having a broader view and trying to control all different areas of dentistry obviously is the most difficult, but also is the more rewarding as far as being able to deliver something that is totally different from what other dentists can provide if they are only specialists in one area. Well, you know, dentistry is my hobby, but now I'm learning to get away of dentistry. I think with my 2-volume books, I gave what I owe to dentistry and what I owe to my mentors, especially Raf Yudelis. You know, I think I did my part of the job. I think now I can relax and retire, and you know. And I would love to do other things in life. You know, I think if you want to get to such a point in your career where you want to excel with the rest of your international friends, there is a lot of effort in the back that people don't see. A lot of things that I have to give up. I've been all my life outside of my country. Those are things that we never say. It's like if you want to be Nadal, Rafael Nadal in tennis, be a pro, be on the top of the crest. Once you get to and you grind the Everest, and when you get to the summit, and you realize that you're Rafa Nadal, you know, by the time that you get there, you are so tired and so burned out that sometimes you say, was it worth it? Yes, it is worth it, but you gave a lot of things. So hobbies is something that sometimes you have to start learning again. As a hobby, I love skiing, photography, and I try to combine both of them. And you know, this is what I enjoy the most, as far as being able to enjoy other parts of what I do is photography, traveling, skiing. This is maybe what I like the most.